In this winter, the European Union has seen the co-circulation of three viruses, influenza, the respiratory syncytial virus RSV, and COVID-19. And what we can anticipate is that COVID-19 will also periodically place a burden and a strain on public health systems in the coming years, especially when we look at this together with other diseases like influenza and RSV. Now this highlights how important it is for vulnerable individuals to be vaccinated according to the national recommendations, in particular when we're looking at the situation right now for influenza and COVID-19, but of course also for other diseases. But that is not an easy task to achieve, because one of the main challenges right now is the lack of confidence and the lack of trust in these vaccines, and the lack of trust in particular to new or existing vaccines can undermine the expectation that these vaccines will be effective in helping to prevent a specific disease. So overall, this lack of confidence is influenced by several factors. One is a general mistrust in the vaccines at all, in the safety of a vaccine, the conviction it's not necessary to take a vaccine, or issues with the access to vaccine. All of these reasons are relevant for COVID-19, but of course also for other vaccinations. And we have seen really with concern in the last years how the decline of in vaccine confidence has impacted the uptake of vaccine and the success of the vaccination programs. And we have to say, vaccines are still one of the most effective public health interventions that we have. So many people also believe in this and follow the recommendations, but in general, vaccine hesitancy is now at the point where it can threaten the progress made in tackling vaccine preventable diseases. And in order to optimize the vaccine uptake, communication and community engagement needs to be enhanced to build the acceptance for the vaccines and the confidence, and to overcome the barriers that hinder right now the uptake. And there are several actions that can be taken. Reminding people about the importance of getting the vaccine, but then also helping them and creating opportunities and fora where they can ask their questions. That is the most important thing there, because many people have just questions that they want to be answered before they get the vaccine. Then making the vaccines available in very familiar and easy to reach settings, and addressing misinformation, which is easier said than done, but there are ways to do this. And we can only succeed in this, and that we have been discussing today, if we work together, and that includes all of us who are sitting here. The policymakers, healthcare professionals, scientists, journalists, and many other groups. So as such, we from ECDC will continue to support Slovenia and other countries in their efforts to increase the vaccination acceptance and uptake, because only if we work together, we are safe together in the end.